this platform, we hope that companies from around the region can draw valuable insights to enhance their understanding of WSH. Not surprising that leading organizations place much attention to WSH in order to overcome these new challenges.
They are low on the working agenda of many governments, and public awareness is very low.
We don't manage work at height by employing more stretcher bearers. We don't say we need more orthopedic surgeons to look after our construction workers. So in exactly the same way, the solution to health in the workplace is the prevention of harm.
So when you're making a hard-nosed decision about whether it's worth the money to take safety to a new level in a company, it's important that the full financial risks you are taking by not doing so are assessed and understood.
We have not gone to the stage where people look after safety themselves, so that's something we need to actually remind people all the time.
Nice. All these capabilities, how can we put it together so that there's synergy?
They cannot subcontract them to their supply chains or their in-house experts or external advisors. If they don't own the risks, they cannot demonstrate the necessary leadership to successfully manage and control them.
WSH journey is not a smooth one. Actually, we faced major challenges at the very beginning.
It is in line with the decision of the State Council for further enhancing work safety.
Business practices of an organization. You have to start understanding how do they make decisions, how does that whole business process roll forward. And then the key was taking the health and safety and integrating it into an organization.
Is the organizational and community level, where we talk about transformative leadership. This is using the power of the leader, the CEO or the manager at the workplace to incite, to stimulate people to change behavior.
We are interested in the well-being of ourselves, our peers and our community. Implement with software such as provision for proper training, right working environment, and proper recognition of our workers.
And sometimes it's the processes we put in place that cause people to make the wrong choice.
And really our target is for zero accident in all our work sites.
We need a certain safety language that they can communicate effectively so that they know what is right, what is wrong.
And there should be provisions for a safe and dignified transition towards retirement. And lastly, don't forget about fitness to work issues and also health issues, because this population does have health issues which might impact work.
And we need to be cognizant of that. And so the question that we're asking ourselves is, how do we keep this number at zero? How do we eradicate these critical near-miss events from our operations? And how do we create the value that people are expecting from us in the area of health and safety?
We thought that we should leave this to the Ministry of Health to take care to come up with promotional and prevention activities. For me, non-communicable disease should be a concern of all OSH authority.
For some of these diseases, such as cancer, it may not even be clear whether there was an occupational cause or not. And this can lead to underreporting of numbers of occupational cancers, etc.
think is the most burning, pressing problem in their own countries on occupational health or workers' health, if we put a bit wider perspective of that.
We are able to monitor the situation, then we're able to take appropriate actions, I think, on site.
So if you find out that you have a machine and there's some improvements you want to do on that particular machine, so that's when we go through all these changes.
What is best practice today should be normal practice by next year or maybe 6 months' time.
You can see the purpose of the scheme is not only to support the SME, but help the government to change the mind, to change the decision.
So you have to move towards this where you become independent by themselves, but I'm talking about not only my staff, it's also including the contractors. They have to own the safety, they have to own the safety, they have to believe in safety.
And say, look, safety has to be the second part of you, right? So nothing else is more important than that.
We must work harder and probably smarter to achieve a breakthrough.
Many of the problems in the construction site are already built into the project before you turn the first sod in the ground.
The government cannot undertake this journey alone. Every one of us must work together as we strive towards a better future.
Well, I think this year, with the integrating with the safety and health, the holistic approach, I think is something unique.
Conference. It was a great opportunity to hear some expert views on the subject and listen to some practical examples of how to deal with that issue successfully.
Things can change in the economy, but the life of workers are important to us, and irrespective of what happens to the economy.
And being that Singapore is the hub of technology globally, I think that would be a great introduction and see how that can actually have a flow-on effect for others.
I really look forward to seeing I guess I'm going to take a different slant, the regulatory body being a more active part in the projects and providing their support through their presence and visibility.